Hello students, welcome to the class of Biochemistry. Myself Dr.R.surekha, lecturer, Department of Biochemistry, SRM Dental College, Ramapuram. Today we're going to discuss in detail about zinc. The minerals are classified into macro mineral and micro mineral based on the daily requirement. If the requirement of the mineral is greater than 100 mg per day, it is referred to as macro mineral. Example, calcium, sodium, potassium, magnesium, phosphorus. Whereas the requirement of the mineral is less than 100 mg per day, it is referred to as micro mineral or trace elements. Example, zinc, copper, iron, iodine, fluoride, etc. In this lecture, we're going to discuss in detail about the sources, RDA, functions and deficiency disorders of zinc. Zinc is a trace mineral. The total body content of zinc was found to be 2 gram. The prostate gland is found to have a highest quantity of zinc, that is 100 mg per gram. Zinc is mainly found in the intracellular compartments. About 60% of zinc is present in the muscle and 30% in the bone. It is also found present in the major organs like liver, brain and skin. Let us look into the sources of zinc. From the animal-based food, the milk and milk products, poultry, shellfish and meat found to have the highest quantity of zinc. From the plant-based food, spinach, legumes, mushrooms, whole grains found to have the richest sources of zinc. Previously, we have seen various sources of zinc. In spite of that, colostrum is found to have a richest sources of zinc. When you look into the recommended dietary elements of zinc, the adult requires 15 mg of zinc every day. The children requires 10 mg of zinc every day. The pregnant and the lactating women requires 15 to 20 mg of zinc every day. So the requirement is found to be less than 100 mg per day. So zinc is considered as micro element. This slide shows the absorption and excretion of zinc. The zinc is absorbed mainly in the duodenum of small intestine. The zinc from the animal sources is better absorbed when compared to the plant sources. After absorption, the zinc binds to the plasma protein called albumin and alpha-2 macroglobulin and gets transported to the major organs like liver, kidney, pancreas and intestine. There it gets bind to the metallothionein, which is a zinc binding protein which is involved in the regulation of zinc metabolism. The excess zinc gets excreted in the urine, bile, in the pancreatic fluid and also in the milk in the lactating mothers. That's why the colostrum contains the highest concentration of zinc. These are the various factors which promotes the zinc absorption and also decreases the zinc absorption. The factors influencing zinc absorption is small peptides and the amino acids, whereas the factors which decreases the zinc absorption is phytate, calcium, copper. They just compete with the zinc absorption, so the zinc absorption will be diminished. Let us now discuss about the functions of zinc. Zinc involved in the major biochemical functions. It acts as a cofactor for many metalloenzymes such as carbonic anhydrase, which involved in the acid-base balance, alkaline phosphatase, superoxide dismutase, which act as antioxidant, RNA DNA polymerases, which involved in the synthesis of RNA and the DNA, and profibrinogen synthase of heme synthesis. So for these many enzymes, the zinc acts as a cofactor. Also, the zinc acts as an activator for zinc finger protein called DNA binding protein. Other than biochemical functions of zinc, zinc will also involve in the cellular functions like growth and cell division, immune function, tissue growth repair and wound healing. The zinc also involved in the endocrinological functions such as reproduction. In reproduction, the spermatogenesis rely on the zinc. The thyroid function, the pancreatic functions like insulin storage and release, prolactin secretion, thymopoietin synthesis, these are all the various endocrinological functions where zinc plays a major role. Also, the zinc has a role in neurological functions like cognition, memory, taste acuity. For the taste acuity, the gustin is the major protein involved. For the synthesis and the functioning of the gustin, which is present in the taste bud, the zinc is very, very important. Also, zinc involved in the vision because the synthesis of retinol binding protein depend on zinc. Also, zinc has a major role in hematological function. It involves in the coagulation factors and also in the heme synthesis. Skeletal functions like bone mineralization where zinc plays a major role. Now we have come to the zinc deficiency causes. So the first cause is the dietary zinc depletion. So which is due to the diet which is low in zinc. If we supposed to intake any diet which is low zinc content, so the person will be encountering zinc deficiency. Malabsorption is the second factor where the binding of zinc to phytate fiber, iron and copper. This lowers the zinc absorption, so leads to a zinc deficiency symptoms. Alcoholism, alcohol consumption also interferes with the zinc absorption, so zinc deficiency will be resulting in. Chronic renal disease, genetic disorders, these are all the various factors which influences the zinc deficiency disorders. The clinical features of zinc deficiency involves mild and moderate and severe. In mild clinical deficiency, person will be encountering depressed immunity, impaired taste and smell, onset of night blindness, decreased spermatogenesis. In the moderate zinc deficiency, the person will be encountering growth retardation, delayed puberty in adolescents, hypogonadism in males, rough skin, poor appetite, mental lethargy, delayed wound healing, and night blindness. In the severe zinc deficiency, the person will be suffering from severe immune suppression, so the person will be frequently prone to infections. And bullous pustular dermatitis, this is the picture showing bullous pustular dermatitis where the water-filled bristles will be seen all over the body, followed by diarrhea, alopecia. Alopecia is the loss of hair, the like a patches. A person will be developing a hair loss like a patches. So this is a picture showing alopecia. This slide shows the inherited disorder of zinc, that is acrodermatitis enteropathica. So in this defect, the gene encoding the intestinal zinc absorption protein is deficit. That leads to a deficit in the zinc transportation. So that leads to a development of symptoms such as erythromatous, vesiculobullous dermatitis, alopecia, diarrhea, ophthalmic disorders, severe growth retardation, delayed sexual maturation, neuropsychiatric manifestations, and frequent infections. This slide shows the picture of acrodermatitis enteropathica in an infant. Here the child had developed erythematous plaques on the cheeks and the buttocks. So when the inherited defect in the absorption and the transportation of zinc is affected, which leads to a development of lesions. So this is how it will be looking like. So treatment for this is the replacement dose of 3 milligram per kg per day of elemental zinc is supplied to the individual to reduce the symptoms of acrodermatitis enteropathica. Thank you.